As a first aider, you may find yourself in stressful emergency situations. Keep calm and remember the chain of survival. Early recognition and summoning of medical help. Good effective CPR. The early arrival of an AED and getting the patient to definitive care as soon as possible. In any first aid situation, the first thing that I need to check for is danger. Is the scene safe for the first aider? Examples of things that I will be checking for are falling objects, moving traffic, bodily fluids. Is the scene safe for the first aider? Once I'm happy that the scene is safe for the first aider, I will then attempt to get a response from the patient. Firstly, I will talk. Ask the patient, can they hear me? Can you open your eyes? Tell them I'm a first aider and I'm here to help you. If the patient doesn't respond to my voice, I will attempt to gently shake them by the shoulders, whilst asking them, can you hear me? Open your eyes. If the patient doesn't respond, that tells me clearly that they are unresponsive. I need assistance. I'm going to shout for help clearly 3 times.
Help! Help! Help!
It is essential that the patient has a clear and open airway. I will now look into the patient's mouth for any obstructions, and using a head tilt and chin lift, I will open their airway. I will now check the patient's breathing by looking down the line of their chest for the rise and fall. I will spend no longer than 10 seconds checking for normal breathing. Do not confuse the occasional gasp with normal breathing. Remember, you should look, listen and feel for no more than 10 seconds. If my patient is breathing normally, I will put them in the recovery position. This will protect the patient's airway until professional medical help arrives.
I need you to call an ambulance for me and bring the AED from reception as fast as you can. Okay.
Once I am confident that my assistance has been summoned, I will now begin cardiopulmonary resuscitation, otherwise known as CPR. Place the heel of your hand in the centre of the patient's chest. Place your other hand over the top and interlock your fingers. Keep your arms straight and begin your compressions. Give 30 compressions at a depth of 5 to 6 centimetres and a speed of 100 to 120 per minute. That's roughly 2 every second. After 30 compressions, we will now attempt to give 2 breaths. Tilt the patient's head back, pinch their nose, place your mouth around theirs and blow. Move your head away between each breath so that you can observe the rise and fall of the patient's chest. Remember, only attempt 2 breaths. Only stop if you become exhausted, the patient makes a significant recovery, or somebody is ready to take over. When the AED arrives, it is important that CPR continues. Open the lid of the AED and follow the voice prompts.
Tear open package and remove pads. Peel 1 pad from plastic liner. Place 1 pad on bare upper chest. Peel 2nd pad and place on bare lower chest as shown. Do not touch patient. Analyzing rhythm. Shock advised. Charging. Stand clear. Push flashing button to deliver shock. Stand clear. Shock delivered. It is now safe to touch the patient. Give 30 compressions. Then give 2 breaths. Start CPR.
If you are using oxygen, ensure that at the time you push the flashing button, the oxygen cylinder and mask are at least 1 metre away from the patient. To conclude, as a first aider, you may find yourself in stressful emergency situations. Keep calm and remember the chain of survival. early recognition and summoning of medical help, good effective CPR, the early arrival of an AED, and getting the patient to definitive care as soon as possible.